Parkinson is one of the so-called incurable diseases, and the brain research in the past, due to this incurable, didn't do many things except of watching what medical could be done for the patients, but not in the direction to cure them, just to give some medicine, and but not with the result that the patients are cured. Now, the research is changing, and it's very important and interesting what is going on in the research due to this so-called incurable disease. Dear spectators, heartily welcome to Querdenken TV, this time from Valencia in Spain. You are, Alfredo, a neuropsychologist.
Correct.
What is the profession? What is the job of a neuropsychologist?
A neuropsychologist is a new profession. It's something that patients needed for a long time. We have neurologists that work with drugs and symptoms, and we have psychologists that deal with emotions. However, some patients do have certain illnesses, certain affections that involve both fields. It was developed a few years back, a profession that will work on both things. Affections in the brain and how this would affect a patient in their everyday life. Their learning, their social skills, how everything would come as one. So basically it's a profession that is an integration of different fields.
Mm-hmm.
Parkinson is a very complex illness.
Yes.
And we need more professionals to work together to help the patient be more positive, be more effective in the daily life. And basically this is the job of a neuropsychologist, to manage different specialists and different professions and put them all together for the well-being of the patient.
And this has something to do with the new treatment, because you are working in a clinic which works with a special and a new treatment dealing and curing Parkinson.
When we work with Parkinson, there are many questions from patients, from other professionals, from people in general. They want to know how effective this new treatment is, or how effective we can work against this illness. So one of the jobs of a neuropsychologist is, since we integrate different professions, we also develop research. When we develop research, we basically know the steps or what we want to find out about the illness, and about how to evaluate the effectiveness of an illness. So one of the reasons why a neuropsychologist starts working with this new treatment and this clinic is because we develop new ways to find out about the cure, the illness, and the professionals that are needed to help the patient.
Mm-hmm.
So in this new treatment, we have developed different ways of studying the illness and the effectiveness of the treatment that we're offering to the patient.
The patients suffering from Parkinson, I can imagine, have problems with depression. They are, of course, not lucky. They are really unhappy. Is this a job and point you are dealing with as well?
Correct. Normally, most of the Parkinson's patient, and this is not in all the cases, but in most cases, patients they have an initial depression state, which they do not understand why this comes. They do not know why this is happening. So they start with a little bit of depression. After the diagnosis is made, the level of depression increases.
Yes, of course.
When you find out that you're ill, then your level of depression increases.
Especially if it's incurable or so-called incurable.
Especially when they're told
Yeah.
it's incurable. And when a patient is depressed, that's when the illness takes more advantage. Because Parkinson's patients, they show more symptoms when they are depressed, when they're anxious, when they are stressed. So we need to explain this to the patient, to tell them that it's normal to be a little depressed, but we need to evaluate the depression, how depressed they are, and we need to start finding out more alternatives so they can recover a little better.
Yeah. The usual way is giving medical treatments to the patients, but it's not a way of curing them.
Correct. Normally, the best treatment that we have in general terms is drugs.
Yeah.
If you feel depressed, you take a drug.
Yeah.
If you have shaking, you take a drug. And the more symptoms you have, the more drugs you take.
And the more side effects you
And the more side effects you will
more drugs
present.
you need.
Correct.
Yes.
And you will need more drugs to stop those side effects. So what we've seen is that there are natural antidepressants. Natural antidepressants are doing exercise, social interaction. All of these positive activities would help a patient being more successful other than just being at home, sitting and watching television all day. Obviously, everybody that would do something like that would start becoming more and more depressed. But if we have a way of knowing this, if we talk to the family, if we talk to the patient, we know that this is not the right behavior, that we need to change the behavior. If we do exercise, if we socialize, if we do other things, then the person would start being better in general terms.
Yep.
So we don't need antidepressants. We would just need for the patient to start doing activities, and that is a natural antidepressant.
And with the method of the forever needle, there is a chance of really healing the people, not just giving drugs,
Correct.
but really healing the patients.
It is very interesting. After the research that we've done, we've seen that this is a treatment that is complementary to everything. It's a treatment that would help a patient being more productive, being less depressed. And over a year's period, we have seen, and it's all documented, that with this treatment, patients would not need to increase the medication over a year's time and even more time. So what happens is that a normal Parkinson's patient would have a normal life, but they would need more medication with time. When they take our treatment, they would maintain the same level without the need of increasing medication. And if, in addition to that, we help them with other therapies, then the patient would not need to take antidepressants, would not need to take sleeping pills, would not need to take other drugs that would affect the Parkinson's patient's general life.
So the life improves due to this treatment on in several subjects, not only with the Parkinson, but all the other subject will be improving as well.
It's very important that when we work with a Parkinson's patient, we let them know that although it might not be right an immediate change in their life, with their work and with our work, their lifestyle would improve dramatically. Why? Because they would not need to take more sleeping pills, they would not need to take antidepressants, they would not need to take so many drugs, because that's what it is. It's a drug, and being a drug, patients have the tendency of being addicted to it. So they want to take more, thinking that the more they take, the better they will be.
Yeah.
So we need to explain that it's not the case, that the more they take, it's taking away period of time in a few years. So we need to tell them and explain to them that they need to reduce the medication little by little, and they need to do other things in order to become better. It's very important that the patient works with the neurologist, with the psychologist, with the physiotherapist, and in their own home with the family, because this is a teamwork. If the patient wants to be better just being sitting at home watching television, it's something that we will not be able to accomplish. Yeah. But working together, their lifestyle would improve dramatically.
Is there any importance of nutrition, what you eat, what you drink, in this whole treatment as well?
Yes. We have seen that there are other aspects. For example, eating healthy, sleeping well, doing exercise. All of these are things that we need to work with. Why? Because a patient, it's just like if you smoke.
Yeah.
If you smoke, you would have the coughing, you would have the yellow teeth, the yellow fingers, and there is no treatment that would help you if you don't stop smoking.
Yeah, that's right.
So we need to change the lifestyle of the patient, yes. And the patient will improve a lot. Positive attitude, positive energy with the patient would help a lot in their lifestyle.
Yeah. The Forever Needle gives a chance the first time for coming to on a way to cure Parkinson. What is your
in our
opinion?
expert opinion is that we are still working on a cure. I cannot say that it would be a definite cure. However, we have seen patients improve dramatically.
Yeah.
And that is very important for patients. If a patient improves, if a patient is feeling well, for us, that's the most important. If they can continue with their life 10, 15, 20 more years with a good life quality, that's our best option. There is no drug at this time that would offer something like this. It's very expensive to take drugs, it's very time consuming, and in general, it affects brain and tissue inside your body. But there are so many things that you can do naturally that would help the patient. So we think that there are very good possibilities for the patient to be better.
We were talking about the drugs and we were talking about the side effects of the drugs. Do you have seen any side effects of the Forever Needle?
Yes, there are many side effects. There are compulsive illnesses that would arise from medication, from excess taking of medication. For example, compulsive eating. People would start eating without stopping or without knowing why. Compulsive shopping. Ludopathy. People would spend a little fortune playing lotto games, playing lottery. All of these would be some things that even sometimes patients would present a sexual addiction, and it's not part of Parkinson's, it's part of the medication. And we need to explain this to the patients so they know what is part of the medication, what is part of the illness, and that all of these can change if they change the medication.
Yeah. These are the side effects of the medication.
Correct.
Are there any side effects of using the needle? If there's, did you see every side effects if you give the needle to the patients? Something like this?
We have studied many cases, many patients. We have researched the material and we have not found one negative side effect. The material that we use is very high quality. It's the one that is used in prosthetic surgery, for example, knees, shoulders, all of these, and
hips.
Yes. Titanium is a very it's an excellent material to work with. So we have not found any side effect or negative side effect to the fact that we used it. And we have researched extensively. We have seen over 40 or 50 patients in a year time period with every single medication, every single pill, and we have not seen any changes because of the needle. So we can say that there are no side effects when using the needle.
So it's a great chance for those patients, and really hope for Parkinson and the possibility to heal and to cure a so-called incurable disease.
Correct. It's, in my opinion, this is a very good opportunity for patients that are looking for an alternative. Sometimes there are patients that would not tolerate the medication, would not like to take drugs, would look for an alternative. This is a very good option for them, because, being honest, the options are very simple. Either drugs, surgery, and all of these are within a very short time period. But with this treatment, we can say that this is treatment for many, many years in your life.
Yeah. So every patient has to decide which way he or she is going. Thank you very much.
You're very welcome.
Dear spectators, we fade in the website from Ulrich Werth. You get a lot of information about the subject Parkinson, about the illness Parkinson, and the possibility to cure it. And of course, via the website, you have the possibility to get in contact with the clinic and in contact to the chance just to cure a so-called incurable disease. Then I would like to show one publication. Unfortunately, it's in the moment only in Germany. Parkinson is heilbar, Parkinson is curable. Das Geheimnis der ewigen Nadel, the secret of the forever needle. Thank you very much for watching. Goodbye and auf Wiedersehen until the next time, this time from Valencia in Spain.